Hi, I'm Dr. Rajkumar, Director Research at MedGenome, particularly with regard to oncology. And today I'm going to be talking on the oral cavity and oropharyngeal cancers. Now, people generally mistake oral cavity or oral cancers as one entity, which is one entity, but there is also another entity which is called as oropharyngeal. This is the back part of the oral cavity. So this encompasses the tonsils, the back of the tongue, and the throat. What you see in the mirror when you say open your mouth and say, yeah, that's the throat which you see. So that is the back part. So this is the oropharyngeal part. Now, coming to the cause for this cancer, you'll find most important ones are definitely tobacco. Tobacco in any form, chewing, smoking, vaping, any of this increases the risk for oral cancer and oropharyngeal cancer. Now, additionally, alcohol also increases the risk for oral cancer. Now, when a person consumes both alcohol as well as smokes or uses tobacco in any form, it again multiplies the risk significantly. Now, apart from this, there are less common causes like sharp tooth, etc. But these are much less. But you'll find occasionally people with poor dentition, with a sharp tooth, coming with tongue cancers because they keep frequently biting off the tongue, and therefore that leads to chronic inflammation. One other factor which is also important more recently is what we call as human papillomavirus. Now, human papillomavirus, I think most of you will be aware that it is associated with cervical cancer. But human papillomavirus, the high-risk subtypes, are associated not only with cervical cancer but also with anal cancer, especially with gay population, as well as also with oropharyngeal cancers. The significance of human papillomavirus in oral cavity cancers, that is just the front part of the mouth, is much smaller. Basically, if you look at the incidence wise, the whole oral cancers as such, the prevalence rate is something like 19 per 100,000 population, which will translate to a huge number. And this is because of the habits. Now, of this, the human papillomavirus contributes to only 6% in oral cancers, and oropharyngeal, it is 3 to 4 times more. That is almost 25% of these are likely to be HPV, human papillomavirus associated. Now, what would you want to do to prevent this? Now, fortunately, now we have vaccines against human papillomavirus. Earlier, these were available only from the West. It had to be imported. So the Gardasil as well as Cervarix. Now, Gardasil was effective against 4 HPV subtypes, 2 of which were high risk and 2 were low risk. Low risk HPV subtypes cause what we call as skin lesions, warts, whereas the high risk subtype 16 and 18 cause cancers, especially cervical cancer, anal cancer, the oropharyngeal cancers. Oral cavity cancers are very small in number due to HPV. Now, the other fact which we need to remember is, fortunately, Serum Institute in our country has been able to produce Cervac vaccine which covers 4 HPV subtypes. This is like the quadrivalent Gardasil. So for the same HPV 6, 11 and 16 and 18 are covered in this vaccine from Serum Institute. And it costs less compared to what you get in the Western, the Gardasil, the multinational companies. Now, what would be the dose for this? Now, ideally, you should be vaccinating the girls. This is what is recommended. You vaccinate the girls between 9 to 14 years of age, in which case you need only 2 doses. So you give dose, let's say today you're giving the dose. The next dose can be given after 6 to 12 months. You have a range there. Whereas if the girl is beyond 14 years of age, you can go up to 26 years of age provided they are not sexually active, in which case you can need to give 3 doses. So here you will give day 0, which is today, like you're giving it today, and then it is given after 1 to 2 months, and then the third dose comes after 6 months. This is the best schedule, which is for all the vaccines which are going to be administered. Now, per se, the protection from these viruses, the high-risk subtypes which we see, is very substantial. And this has been proven, and it is to the extent of 95%. So, one final word is, do not stop with vaccinating girls alone. Boys also should be vaccinated. So, I'll stop here.